Ever wonder what that little pill you take for heartburn is actually doing inside your body? Let's talk about proton pump inhibitors, or PPIs. You probably know them by names like Omeprazole or pantoprazole. They are some of the most commonly prescribed medications in the world for things like acid reflux and GERD. But how do they really work their magic? Imagine your stomach lining is covered in tiny little pumps called proton pumps. Their job is to churn out hydrochloric acid, which helps you digest food. When you have too much acid, or it starts creeping up where it shouldn't, that's when you feel that familiar burning sensation. Now, here's where PPIs come in. When you swallow one, it travels through your digestive system, gets absorbed into your bloodstream, and then makes its way to those acid-producing pumps in your stomach. And what it does next is pretty dramatic. It doesn't just turn them off temporarily. It irreversibly blocks them. It's like putting a permanent lock on the acid factory. This is why PPIs are so incredibly effective. Once a pump is blocked, it can't make any more acid. Your body has to build brand new pumps from scratch to start acid production again, and that process takes time, several days, in fact. This explains why a single pill can provide relief that lasts much longer than simple antacids, which just neutralize the acid that's already there. So by shutting down the source, PPIs give your esophagus a chance to heal from acid damage. But like with many things in medicine, it's not all sunshine and roses. Our bodies are complex ecosystems, and changing one thing can have ripple effects elsewhere. Stomach acid isn't just there for digestion. It is also our first line of defense against harmful bacteria and other pathogens we might swallow with our food or water. When we dramatically reduce stomach acid levels for a long time, we're essentially lowering the security gate. This can change the delicate balance of your gut microbiome, the community of trillions of bacteria living in your intestines. Some studies suggest that long-term PPI use might allow less desirable bacteria to thrive, potentially leading to an imbalance. This altered gut environment can sometimes increase the risk of certain gut infections. For example, you might have heard of C. difficile, a nasty bug that can cause severe diarrhea. With less stomach acid to kill it off, it might have an easier time setting up shop. The same goes for other infections, like bacterial gastroenteritis. Another important point to consider is nutrient absorption. Stomach acid is crucial for helping us absorb certain essential nutrients from our food. Think of it as a key that unlocks vitamins and minerals so our body can use them. Specifically, we need acid to properly absorb vitamin B12, iron, and magnesium. So if you're on PPIs for a long time, your body might struggle to get enough of these key nutrients. A deficiency in vitamin B12 can lead to fatigue and nerve problems, while low magnesium can cause muscle cramps and other issues. This is why if you're on PPIs long-term, your doctor might want to monitor your nutrient levels just to be safe. Now, this isn't meant to scare you or tell you to throw your medication away. Absolutely not. PPIs are fantastic and often necessary medications that have helped millions of people manage painful and dangerous conditions. For many, the benefits of healing an inflamed esophagus and preventing serious complications far outweigh the potential risks. The key is to use them wisely and under the guidance of your healthcare provider. They are typically intended for short-term use, but for some chronic conditions, long-term use is necessary. It's all about having an open conversation with your doctor. You can discuss the lowest effective dose for you, how long you should be on it, and whether you need to be monitored for any potential side effects. So the next time you hear about PPIs, you'll know they're powerful little molecules that put a lock on your stomach's acid pumps, providing long-lasting relief, but also reminding us of the intricate balance within our gut. If you found this deep dive into your gut health interesting, hit that like button and subscribe for more health explainers. Thanks for watching, and stay curious.